Okay, so, I think probably the biggest fear that everybody has whenever they have a cyst is, do I have cancer? Right. And I think reflexively, we're always like, no, 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 it's okay, you don't have cancer. But I do think there are some things that are important to tell our patient in terms of safety when you have a cyst. So the first thing is if you have a cyst that's really large, admittedly, it can increase your risk of ovarian torsion. Can you tell us a little bit about that?
Yeah, so I talk to my patients a lot about this. So, ovarian torsion is any time that the ovary is kind of big and large or lopsided, it can turn on itself. Okay. And it has its little blood vessels, almost you can imagine like a little tube going to it. And then if it turns, right, it's going to cut off its blood supply. It can happen really with any ovary, but when they are big and have a cyst on it and they're kind of lopsided, it's more likely to happen. This can present as all of a sudden sharp pain. Sometimes it comes and goes because it actually can be turning and then going back, turning and then going back. It can cause nausea and vomiting when it's happening. It's very, very painful. It is a surgical emergency. If you know you have a cyst and you start getting symptoms like this, you really need to go to the nearest emergency room because you might actually need surgery to detorse or untangle that ovary and its blood supply and get all the blood flowing back to it, or you could lose that ovary.